We tell people that you need to read the brochure, don't smoke, don't drink, but then we make these enormous billboards that tell them to smoke, drink, and smoke while they're drinking and drink while they're smoking. And then we distribute these things according to class, basically. And this is the same stratification by neighborhood, with the poorer neighborhoods being on the far side, and these are liquor licenses per capita. This is a foreclosure hot zone map. This happens to be in Fresno, looking at low-income communities where the foreclosure crisis is so concentrated that it has essentially macro-level impacts. The neighborhood basically starts to deteriorate because there are so many foreclosed homes. These are payday lenders. This happens to be Los Angeles, another community in which we're working, looking at payday lenders and the concentration of African Americans and Latinos with a very strong correlation. In fact, the Center for Responsible Lending did an analysis and found that race and ethnicity play a pretty limited role in the location of mainstream financial institutions, but when it comes to these payday loans, that's where these things are situated. I'm rushing a little bit because I'm noting the time. Okay, oh boy, that's even less time than I had hoped. All right, I wanted to show this slide because it's devastating. And I just want you to focus on the red, which is the stratification of CST scores in the Oakland Unified School Districts. This was in 2005 again. With the red, reading below basic proficiency, the yellow at basic proficiency, and the green is advanced. African Americans, Latinos, whites, and Asians. These are 4th graders. These are 8th graders. These are 11th graders. Again, 4th grade, 8th grade, 11th grade. In Oakland, African American and Latino 7th graders read below the level of white 3rd graders. 4 grade levels. This has profound public health consequences. Profound. Yet we have no strategy for this. And that is a failure of our critical thinking skills. Nothing else. We don't live in a meritocracy. The hardest working low-income kids that do well in school go to college at a rate of about 78%. Dumb, lazy, rich kids go to college at roughly the same rate. And I used to joke that some of those kids become president. This is Bill Gates addressing the National Governors Association. And Bill Gates, the richest guy, or was the richest guy in the world, decided that he was going to give it all up to become a public health practitioner, and that's what he's doing, literally. He's all the money in the world. What do you want to do? Not go to Disneyland. He wants to practice public health, and that's what he's doing. So I think public health is clearly a very attractive avocation. But he says, and I really appreciate him having said this. He's talking about the American high school system. He says it's obsolete. We should throw it out. A high school diploma is meaningless. If we keep the system as it is, millions of children will never get a chance to fulfill their promise because of their zip code, i.e. where they live, their skin color, race, ethnicity, or the income of their parents' class. He goes on beyond that. So he's not just describing the phenomenon that you can document in GIS. He brings it down to our values. He says it's offensive to our values and it's an insult to who we are. And that's the most important part of this statement. It's offensive to our values, it's an insult to who we are. I'm going to skip this, but it's basically the NIH saying the same thing in NIH speak. And so the question becomes, institutions, what drives these decisions? I mean, we know historically that certain groups of people, either by their race, their class, their gender, their immigration status, have been perceived as being less valuable. Something like Katrina happens, and what do people say? Oh, this is not America. I've never seen, this could not be the America in which I live. When in fact, if you actually look, and you look at the maps of New Orleans, or the maps of Oakland, or the maps of Cleveland, or Baltimore, you see exactly where the Katrina population lives. So it can be a hurricane, it can be pandemic influenza, it can be a foreclosure crisis. This population is going to be hit, and it's going to be hit hard, because we've created the hazardous social conditions that make them vulnerable. And for us to pretend that we don't see this is a lie. We have created this. I'm going to skip this just to reference a heat wave that happened in the Midwest in the 1990s, and the population that died was the Katrina population, the same population that lives in those red zones that we mapped in Alameda County. And one of the commentators about this described the heat wave as a particle accelerator for the city, which made it sped up and made visible the hazardous social conditions that are always present but difficult to perceive, and particularly difficult to perceive if you decide not to look for them. Okay, so the new public health practice is really looking at communities as a whole and the trajectory of whole communities. In high-income communities, they generally have high measures of social attainment, and there's a lot of resiliency factors and resources that help buttress people's life trajectories, and relatively few risk factors. In middle-class communities, you still have a high degree of resiliency factors, slightly more risk factors. In low-income communities, relatively few resources by design. And then in those communities, the schools are not performing well. We know that jobs are difficult to find. They don't pay a living wage. We know that crime is rampant. Many of them are policed like war zones. They're racially and economically segregated. Housing is unaffordable and unhealthy. They're sited proximately to point sources of pollution. And then we look into this kid's eyes, and our answer for this kid is, here's the brochure, pull yourself up by your bootstraps. That's literally what we say. And we know that we can do better than this. I mean, there's examples galore, including this campus, that know that we can do better than this. So this is the medical model, which talks about health disparities, things that exist. And I like to say this very clearly. The medical model is necessary, but not sufficient. You walk into a community and there are fires burning, the first thing you do is you put out the fires. But if you come back the next day and there are fires burning in exactly the same spot, you got to put the fires out again, but you got to start thinking, well, why are fires burning here? And what can I do to prevent those fires? And that takes you upstream into the socio-ecological context in the domain of health and social inequities. And we have interventions here. They're very expensive. We're bankrupting our systems, trying to solve this problem on the downstream end exclusively. And we need to start marching upstream to think about what solutions and strategies create the conditions that create these outcomes, and what can we do about those conditions. At the California Endowment, we call this very simply, or at least I call it very simply, and nobody's contradicted me yet, place, policy, and values. And that's what the practice is about. The practice is about place, looking physically about the places, looking to try to get grocery stores like Mi Familia, is that what it's called? Mi Pueblo, sorry. Into neighborhoods where people need access to fresh fruits and vegetables. And Larry took me over there this afternoon, or just before this, and showed me the produce section in that store, which is hugely health protective. And it's because of conscious decisions made by people recognizing that land use planning has an impact on health, and we have to engage in smart land use planning. So this very campus is an example of good critical thinking being applied to health. And I can tell you that that is not happening in many other parts of the state. We also have to look at the policies that create the conditions in places, and we have to look at the values. Ultimately, what kind of community are we? What do we believe in? Does justice matter to us? Does equity matter to us? Does opportunity matter to us? Okay, I'm going to skip through this because this is mostly about what the California Endowment's doing, and I really would like to have some questions. So last slide. This is, and I'll leave this up as we talk. This has been our strategy. It's basically 3 pillars to this work. You have to build the power of community, people that are impacted adversely by the conditions that we have collectively created. They have to be involved in designing the solutions. We have to look at policy and both the health impacts of health policy and the health impacts of non-health policy. And we have to create a new narrative. We have to start talking about the values that are important, that should undergird a health system. It's not just about individual responsibility, it's also about collective responsibility. It's about equity, it's about fairness, it's about justice. So with that, I'll stop, and I'm more than happy to take any questions.